Hello everybody. Today we will be talking about smoking or tobacco cessation. This is one of the most important parts of our treatment as dental hygienists because this can cause a permanent lifestyle change in our patients. It is our duty as dental hygienists to open the window to change for our patients and offer advice, our knowledge, our vast knowledge about tobacco and its effects on the human body, and basically let them know that they have a resource to open the window to quitting smoking. We would advise them about any risks and overall gauge their lifestyle to see whether quitting smoking will be beneficial. 100% of the time it is. We would ask them about their smoking habits, their frequency, what triggers them, and any previous quit attempts. This is found in the medical history form. In this part of the medical history, we talk about tobacco use, how long they've been using, and then we would complete the tobacco form to overall talk about this use. Here at Plaza, we follow the 5 A's of tobacco cessation. So the first step would be asking, as previously stated. So we would ask them about their triggers, what type of cigarettes they smoke, how often they smoke them. After we get this answer, we would then tell them quickly about the risks of smoking, and this could be anything from lower chance of cardiac arrest to lower blood pressure, lowering the risk of stroke and heart disease. There are financial benefits to quitting smoking as you're not buying cigarettes every day. So this could be something that we tell the patient and then assess whether they want to quit in the first place. So then we would assess whether they would be willing to quit in the next 30 days. We would ask the patient what their thought is on quitting and whether they seem that this is feasible. This could be varied. Their answers can be varied based on the amount of stress in their life, their lifestyle activity level, anything from whether they have kids, whether they don't, whether they're financially stable, whether they have any past experiences with quitting, whether they really want to stop quitting. Just anything like that, our patient will respond, and then we could offer advice as to how making this possible would be possible. Understanding whether our patients want to change is the most important part because we could categorize them under different stages. While either they're contemplating, they're preparing to quit, they're ready to take action, or they're relapsing from a previous quit attempt. Hypothetically, if we had a patient ready to quit, eager to quit, and they want to take that next step in life, they would be in the action stage. So we would furthermore influence them by telling them that they can take action and it actually is possible. If they are unwilling to quit, we can go over the 5 R's of tobacco cessation, which are relevance, risks, rewards, roadblocks, and repetition. The first R, which is relevance, we could tell them how this would be relevant in their life, why quitting would be important for them, whether it could be having children in the home, any other concerns, their age, whether their health would be a real risk factor. And then we would talk about the risks of smoking, shortness of breath, asthma. If they're planning on getting pregnant soon, this would be something that would benefit them. Any other oral implications, emphysema, and then the higher rates of smoking in children of tobacco users if they do have kids. So if you want your kids to not smoke, you could also try and quit smoking. And then we could talk about the rewards of, as previously stated, the rewards of quitting smoking, which would be improved health, you save money, everything smells better because tobacco smells terrible, you feel better, you perform better. And then we could also talk about the roadblocks. So whether you're scared of withdrawal symptoms, we have stuff for that. Fear of failure, any weight gain, lack of support. We are there to support them. And then we could just keep on repeating these exercises. Repetition, even if they try and quit and then they fail, repetition is number one because it may take repeated attempts to quit. We will then once again assess whether our patient wants to quit. If they want to quit, then we would schedule a date for them to begin quitting smoking. And then we would schedule an appointment 1 week from this date just to gauge their progress, whether they're sticking to it, whether they need help, whether they're facing withdrawal symptoms. So 1 week from that beginning quit date, we could also give them resources to reach out to, such as New York State smoking hotlines, the CDC smokefree.com website, anything that they need to boost their knowledge about quitting smoking. Also, just offering resources for them to know that they have help.